The Center for Disease Control has released more alarming facts about the Zika virus for pregnant women in the U.S. And Dr. JJ is here with information to protect us, and she's joined by our very own pregnant mother, Kristen Smith. Before we get started, let's take a look at some of the recent headlines.
Sobering update on Zika today. The nation's top health officials warning that the Zika virus appears to be a lot scarier than first thought.
In the day's other news, health officials reported the number of pregnant women in the U.S. infected with the Zika virus has tripled to 157.
We just learned that 157 pregnant women in the U.S. have tested positive for the disease, according to the CDC.
Dr. JJ, watching that is very scary.
Yeah,
and before we get started, can you briefly remind everybody what the Zika virus is?
Okay, so the Zika virus is carried by the Aedes aegypti mosquito. It's basically that striped mosquito that you saw on the left there, actually. And actually, there's a potential for the Aedes albopicus, which is an American mosquito, to carry it as well. The virus then is transmitted to a human via a bite. And then that human, if she happens to be pregnant and infected, can pass it to her fetus, or it can be passed via the blood through blood transfusion, or it can be passed via sexual transmission, male to female. So that's what we know about Zika and its transmission right now.
And 157 women in the U.S. have been diagnosed with Zika, but did they get it in the U.S. is the question.
No, they didn't, and that's the good news here, because most of these women either traveled to suspect areas or their sexual partners had traveled to those areas and become infected. But women in Puerto Rico who were described, the U.S. Regions, the CDC is following them too. The majority of those women actually got the Zika virus in Puerto Rico, and only 4 of the 800 got it through their travels. So it's endemic already in Puerto Rico, which is pretty close to our shores, but it's not on shore here yet.
Kristen, I don't know if you're traveling abroad anytime soon or if your husband is, but hearing these reports, does that concern you at all?
Well, I think the moment I became a mom is the moment I started to freak out about everything.
Everything.
You know what I mean?
Isn't that true?
You know, like, oh, was that a sneeze? You know what I mean? But now, just seeing those news headlines, it scares me just watching it and talking about the facts and the realities, whether it makes sense or not. I think I can quickly go into like hysterical fear, like, oh my gosh, you know. But I think that's why it's great we're doing this segment, because there are a lot of questions and there are a lot of worries, frankly, that I have about risk factors. Am I at risk? Can I be at risk if I don't travel?
But there's power in information too, and I mean, I think the CDC has done a great job in terms of providing a broad swath of information that is actually more reassuring than scary.
And so the question becomes, what are they doing to prevent these mosquitoes from coming to the mainland?
Yeah, exactly.
Okay, so the key thing is I don't think they fly that far, all right?
That's good news.
But the Aedes
Well, the TSA lines are ridiculous.
Going through security at an airport is enough to keep them out.
But here's the deal. Think of humans who go to suspect areas and get bitten. They may or may not have symptoms. Think of them like a moving van, okay? They move across borders, they come to the United States. Then the same species of mosquito, which resides in 30 of our states, usually in the southern part of the United States, if those mosquitoes bite a person who is infected, who has moved in their van from there to here, then that mosquito in its travails can bite 5, 10, 15 other people who are unsuspecting. Right. And that's how it's transmitted potentially in this country. And that's why the CDC, because it's such an invisible threat and it's one where there's no marker, that's why there's such a big push to get information out about how we can prevent mosquitoes from breeding, prevent them from transmitting, and what measures we can take if you're pregnant or considering being pregnant to prevent this.
So what are the measures you can take?
So the measures are, the obvious is try not to travel to the areas that are suspect.
Well, the Olympics are coming up.
Of course, and that means that a lot of people are going to be coming.
Sell your ticket?
Coming
Well,
back.
a lot of people from here are going to go there to work, you know.
It's true, and there are a lot of athletes who are going to go and come back as well. So while you are there, if you are traveling to a suspect area, you have to take great measures. Wear long sleeve clothing, long pants, wear insect repellent every single day, and keep the mosquitoes outside. So repair your screens, go in air-conditioned buildings, because these are indoor biters. So we want to make sure that our air is on, that our doors are closed, that windows aren't left open, that screens are repaired, so that we keep those mosquitoes outside. And then any standing water that is around, we dump that standing water because those are breeding grounds for the mosquitoes.
Is there any kind of repellent that is better than another? The question used to be DEET was a chemical that was causing problems for years. What's the situation?
Okay, so the situation is that the Environmental Protection Agency, the EPA, has some recommendations for Zika prevention and for this kind of mosquito-borne prevention. One is DEET. The other one is picaridin, the other one called IR3535. Those can be used in people from 2 months of age all the way up, and whether you're pregnant or breastfeeding, it doesn't matter. Then there are a couple of others. One's called paramenthane diol, and another one called oil of lemon eucalyptus, which smells lovely, but these should not be used in children under the age of 3. And the only tough part is that if you have a baby under the age of 2 months, none of these should be used. So we have to use mosquito netting. We have to keep the kids inside. We really have to sort of cloister or take a vacation and come back up here until your baby's old enough to, to use preventive practices.
And Chris, I know you had some questions for Dr. JJ about this.
Yeah, and I think this is pretty common. I've heard a lot of things, and I think I'm not sure what is accurate and what's not, but what are some of the birth defects that potentially can happen from Zika?
Well, this is what brought this news to the forefront, because in Brazil there was this inordinate amount of babies born who had what's called microcephaly. Microcephaly means literally small head. Now, if you have a small head, you have a small brain, and the brain may not be completely formed. And depending on the time in which the infection happens, if it's in the first and second trimester when the brain is really going through its revolutions and growth, you're more likely to be affected. And so these poor babies, besides having small heads, if they are in the most severe, they may have seizure disorders, cerebral palsy, they may have blindness, they may have hearing problems, intellectual problems, just lifelong learning and intellectual disabilities.
I was pregnant. That freaks me out a little bit. Should I be tested and for precautions? I know people at home are probably asking the same thing.
At this point, unless you have traveled to an area or have an intimate partner who has traveled to an area, there's no need to panic and there's no need to do it. Now, that being said, if anybody showed signs of infection, if they had fever, rash, conjunctivitis, which is redness of the eyes, joint pain, flu-like symptoms, but with a rash and conjunctivitis, and there was a suspicion that they had infection, even if they hadn't traveled, of course you would be tested. So it's really, really key. And there's protocols in place now for every obstetrician in this country for who to test based on risk. So the answer for you right now is no. So that's the good news.
Now, if you have been infected with the Zika virus, and you know you have been, how long should you wait before you try to get pregnant, perhaps? Does it stay in your body forever?
So here's what we know. What we know is that it stays in the blood for at least 3 weeks. What we also know is that it stays in male semen for longer. And so the recommendations now are that for males who have been diagnosed or who've had the symptoms, they should abstain or have protected sex for 6 months after. So not try to get anybody pregnant for 6 months. If there's no symptoms, the recommendation falls to 8 weeks. And for anybody returning from those areas who may have had an infection or know they've gotten bitten, staying away from mosquitoes for 3 weeks too. So canceling those camping trips, canceling those fishing trips, doing, and wearing the clothing and putting the prevention on so that you're not inviting U.S. mosquitoes into your moving van to transport it out to the rest. We're all going to be okay. I think the key thing is information before trouble happens is always good, because then we all have the power to upend all those standing water. We all have the power to get good repellent. We all have the power to cover up. We all have the power to help this not become a problem.
Feel better, Kristen?
A little bit. Talking off the ledge.
When do you do?